2 reasons your blood sugar is high at 3 a.m. Back to naturediabetic.com. You're up at 3 a.m., and your blood sugar is rising again. While there may be many reasons it's high at dawn, the 2 most common reasons are the dawn phenomenon and Somogyi effect. Both involve hormones being released in the body, but for 2 very different reasons. Dawn phenomenon, also known as dawn effect and liver dump. The dawn phenomenon is due to declining levels of insulin and an increase in hormones. Around 3 a.m., the body releases hormones such as cortisol and glucagon. When levels of these hormones increase, it stimulates the liver to release glucose into your bloodstream. The reason for this is your body prepares for the increased energy it will need to wake up, which the glucose will provide. For those without diabetes, the body releases insulin to keep blood sugar levels stable. Somogyi effect. While blood sugar increases in the dawn phenomenon, it decreases in the Somogyi effect. When blood sugar levels drop very low in the early morning hours, it triggers a release of hormones to reverse the low blood sugar. These hormones are called counter-regulatory hormones because they counter the effects of insulin. As a result, this sends your blood sugar levels into a rebound high, called rebound hyperglycemia. This causes high blood sugar in the morning. In other words, early morning hyperglycemia, high blood sugar, occurs because of a rebound effect from late-night hypoglycemia, low blood sugar. Dr. Michael Somogyi, who discovered the Somogyi effect, described the paradoxical tendency of the body to react to hypoglycemia by producing hyperglycemia. How to tell them apart? While the dawn phenomenon is more common, the Somogyi effect is more common in type 1 diabetics. How can you tell what is causing your blood sugar to rise before breakfast? It involves my favorite catchphrase, be a diabetic detective. Unless you wear a continuous glucose monitor, CGM, you will need to test your blood sugars frequently. Experts advise testing before bedtime, around 2 a.m. to 3 a.m., and again when you first wake up for several nights. The ADA recommends waking up with blood glucose levels between 80 to 130 milligrams. Possible treatments to discuss with your doctor for the dawn phenomenon include adjusting insulin dose or timing, not eating a bedtime snack, or exercising after dinner. If the dawn phenomenon affects you, don't wait too long to have breakfast when you wake up. It may signal your body not to release any more hormones. If the Somogyi effect is causing your blood sugar to drop in the middle of the night, you may need to adjust your insulin dose and timing or eat a bedtime snack. Many reasons can contribute to high blood sugar, hyperglycemia, upon waking, but the dawn phenomenon and Somogyi effect should be considered as likely reasons. Both cause hormones to be released in the body. The way to tell them apart is to test your blood sugar frequently throughout the night. Then you and your doctor can determine if your meals and/or medication need to be adjusted. Please remember this is not medical advice or intended to replace the advice of your doctor. Please do not self-diagnose. Always check with your healthcare provider before trying new treatments. I ask you to please keep an open mind, be a diabetic detective and do your own research, work with your healthcare team, see what works best for you, and monitor your blood sugars. Learn how to manage your diabetes naturally at backtonatureddiabetic.com.